Stages of hypnotherapy. Hypnotherapy can be subdivided into 8 stages. Preparing the patient for hypnosis. Hypnotic induction. Deepening of hypnosis. Therapeutic utilization of hypnosis. Ego strengthening. Post-hypnotic suggestions. Self-hypnosis and termination of hypnosis. Stage 1. Preparing the patient for hypnotherapy. Successful hypnotic induction and hypnotherapy requires satisfactory preparation of the patient. Good preparation involves information gathering, clinical assessment, establishing rapport, assessing for hypnotic suggestibility, clarifying misconceptions about hypnosis, providing facilitating information, and organizing the setting for hypnotherapy. Information gathering. Before initiating hypnotherapy, it is important for the therapist to take a detailed clinical history and identify the essential psychological, physiological, and social aspects of the patient's behaviors. This should include functional and dysfunctional patterns of thinking, feeling, bodily responses, and behaviors. To make a reliable diagnosis, the therapist is advised to use standard diagnostic criteria such as the Diagnostic and Statistical Manual of Mental Disorders, American Psychiatric Association, 2000, or the International Classification of Diseases, I-10, World Health Organization, 1992. Specific psychometric measures such as the Beck Depression Inventory, revised, Beck et al., 1996, the Beck Anxiety Inventory, Beck and Steer, 1993, the Beck Hopelessness Scale, Beck and Steer, 1993, and the Revised Hamilton Rating Scale for Depression, RHRSD, Warren, 1994, can also be administered to determine the severity of the symptoms before, during, and after treatment. Eight-step case formulation. 1. List the major symptoms and problems in functioning. 2. Formulate a formal psychiatric diagnosis. 3. Formulate a working hypothesis. 4. Identify the precipitants and activating situations. 5. Explore the origin of negative self-schemas, deeper beliefs. 6. Summarize the working hypothesis. 7. Outline the treatment plan. 8. Identify strengths and assets and predict obstacles to treatment. Establishing rapport. Establishing rapport with the patient is of vital importance. Without good rapport, the patient may not allow himself or herself to fully experience the hypnotic trance. Modern hypnotherapy is a collaborative venture involving cooperation from both the patient and the therapist. Areas 1981, 1985 has described the team approach for the development of trust and positive expectations and attitudes, and for the utilization of the patient's motivation in hypnotherapy as follows. The therapist showing warmth, empathy, and caring. Developing trust by utilizing the therapist's prestige, expertise, and authority. The therapist demonstrating good understanding of the patient's problems. The therapist joining the patient, that is, being able to speak the patient's language. Tailoring treatment to the expectations of the patient. Assessing hypnotic suggestibility. Some clinicians prefer to assess their patient for hypnotic suggestibility in order to determine whether the patient will benefit from hypnotherapy. These clinicians take the view that hypnotic suggestibility is a stable trait that cannot be significantly modified by training. Some individuals are more talented than others at experiencing hypnosis. Hypnosis is not a special process with a one-dimensional EEG brain signature or an either-or state, but a multidimensional experience reflecting various subjective states perceived by the participant. However, this multidimensional experience is a matter of degree. Some individuals can easily enter into a deep trance state and experience full-blown regression, time distortion, significant somatosensory changes, and vivid hallucinations. Others may feel relaxed or carry out simple suggestions but are unable to experience major changes in their body or perceptions. So it's recommended to test for hypnotic suggestibility for several clinical reasons.